Welcome everyone to this webinar with the San Antonio Hispanic Chamber of Commerce in partnership with the Rivard report. My name is Sophie Torres. I'm with the San Antonio Hispanic Chamber of Commerce, and I am very proud to introduce Dr. Erica Gonzalez, our 2020 chair. Thank you.
Good morning, everyone. I would like to welcome everybody to our webinar today. On behalf of the Board of our Directors, our Chair for our Healthcare and Bioscience Committee, Dr. Lisa Ochoa, CEO, President, Major General Juan Ayala, we're all very thankful that you are joining us this morning for our mental health webinar. I don't think that any of us can understate the importance of mental health wellness, especially during this time. And I think that this pandemic has only brought new challenges to everyone. And it reminds me of the saying that although we're all in different boats, we're all in the same storm. And so we're definitely dealing with different things. And I think it's important for us to be able to talk about these things so that we can normalize and take away some of the stigma that's associated with mental health. I want to especially thank UT Health for sponsoring this webinar. And of course, we're very happy to have the editor and publisher of the Rivard report, Mr. Bob Rivard himself, who will be moderating this panel. And without further ado, Bob, if you want to take it away, we can go ahead and get started.
Thank you, Dr. Gonzalez, and thank you, General Ayala, for having the Rivard report partner with you on this important forum and incredibly important and complex topic. I'm very pleased to be here this morning, and we have a distinguished panel. I would like very briefly to introduce each of them. Those of you that are listening in the community will receive an email after the program, and that will include fuller biographies of all three panelists if you care to read a little bit more about each one of them. But let me introduce them. First, Dr. Clarissa Aguilar. She's a behavioral health consultant at the Center for Healthcare Services in San Antonio, which is, of course, is our community clinic that serves as the local mental health authority for Bexar County. And Dr. Adriana Dyurich is a behavioral health consultant, has her PhD in counselor education and supervision, and she's a licensed professional counselor in Texas and deals quite a bit with adults facing life stresses even before the coronavirus outbreak and the ensuing shutdown. And she is both involved in teaching at UT Health San Antonio and also has a private practice based in Corpus Christi. And Dr. Ted Williams is in a private practice as a psychiatrist in San Antonio. He's the founder of the Genesis Behavioral Health, a multidisciplinary clinic of behavioral health disorders, treating adults, children, and adolescents. He's also an adjunct assistant professor in the Department of Psychiatry at the Long School of Medicine at UT Health San Antonio. So welcome, panelists, all three of you, and thank you for being with us today and sharing your valuable time and expertise. And I'd like each of you just to take about 5 minutes, Dr. Aguilar, starting with you, and then we'll move to Dr. Adriana and Dr. Williams. We've all been bombarded every day now for a couple of months with the daily toll of statistics on testing and positive cases, and we're averaging 1 death a day here in Bexar County. But something else is happening under the surface, and that's the extraordinary social and emotional trauma that's being inflicted upon our community, not just by the spread of the virus itself, but by the social and economic shutdown that's occurred, the hundreds of thousands of people now in our community who have lost their jobs, and many of whom are heads of household and sole earners in a household, so there's many dependents involved. Children are not in school. Distant learning has been a noble experiment, but a very difficult undertaking. And of course, we've all seen up close and personal the extraordinary food insecurity in our city, even during the best of times, as the city with the highest percentage of population living in poverty prior to the outbreak. And now things have been made much worse by the outbreak and the shutdown. So all three of you are intimately involved in dealing with issues of emotional trauma, even in normal times. And I'd like you to share your observations about the moment we're living in and the enormity of the challenge and perhaps how you see us going forward. Dr. Aguilar, please.
Hello and good morning, everyone. First, let me say thank you very much for having me on this panel. I'm extremely honored to be participating in this panel today. And thank you, Ms. Rivard, for your introduction and for that nice summary of some of the challenges our community is facing. I'm a licensed clinical psychologist, and part of the work that I do at the Center for Healthcare Services, and especially recently, has been trying to help our patient population and those in our community who have perhaps been the hardest hit manage some of the thoughts, feelings, and some of the real challenges with the impact of COVID-19 on their homes and on their own social and emotional health. We know that what has been so important and vital for the health of our community has been to isolate and quarantine. And while that has really helped us stay physically healthy, it is something that has really challenged the mental health of all of us. I think each one of us has struggled with how difficult that can be in both our home and in our communities and in our workspace. So part of what I wanted to offer and speak to is, as Dr. Gonzalez said, I thought that was a great analogy, that we're all facing the storm. We may not all be in the same boat, but we're in a big storm. And so part of what I thought is so interesting about that analogy is one of the experts in our therapeutic literature, Dr. Russ Harris, talks about this practice or this exercise called dropping the anchor. Because when we're in a big storm and when boats are in the harbor, they have to drop their anchor. And we all know that dropping the anchor does not make the storm go away. But what does it do? Dropping the anchor helps keep us in place. And if those boats don't drop the anchor, they will get swept out to sea, right? And so although anchors can't control the weather, anchors can help us feel more grounded and can keep us together and protect us. And so part of what we have to do as individuals, as parents, as business owners, is understand how to drop our own anchor and stay rooted and grounded. Part of that comes through acknowledging thoughts and feelings, coming back into your body and engaging in the present moment. Now, those are all very big psychological principles. It's something you might hear me talk about with some of the patients that I often have to address. But these are kind of individual strategies that I think can be very helpful as we are trying to navigate a very large storm. Part of the other challenge is that we don't know how long the storm will last. We have projections, we have some possibilities of things ending, things are opening up, but we still need to stay anchored. And so I do know that I guess it's something that I can come back to if anybody is interested in hearing more about these kind of 3 core principles that are part of the dropping the anchor exercise, which is acknowledging your thoughts and feelings, coming back into your body and engaging in what you're doing. That's something I can spend time on. But it is a very important skill that could be helpful going forward. I also know that part of the struggle as an individual for myself is as a parent, trying to manage and juggle all of the different demands on my schedule and on my life. The way that we've come to refer to it in my community is distance learning, in quotes, because it's been so challenging as well to make all that happen. As a parent, we have a lot to juggle and structure. And so there are, things there that we have to be intentional about. So part of what, I guess one more thing I'd like to offer as an individual and as a professional is that it's been very important for me and for the people with whom I work to stay intentional about their own process. So if I am shifting between my workspace and my home space, I might take a moment to make sure that I am thinking about that transition. I think for all of us, and especially as small business owners, your work life tends to bleed into your home life, which tends to bleed into your family life and everything else. And so if we can stay intentional about transitioning between those spaces, and sometimes, and maybe even now, creating bigger, stronger boundaries between each of those spaces, it will be important to learn how to do that going forward. And again, that's something else I can speak to later if somebody's more interested in those sorts of skills and ideas.
Thank you, Dr. Aguilar. The writer in me is loving these metaphors that I'm hearing being thrown out of storms and anchors, so that's great. Dr. Dyurich, your thoughts?
Thank you so much, Bob. Thank you, Dr. Aguilar. Of course, a lot of what I want to share goes hand to hand with what Dr. Aguilar is saying. I think we're going to reinforce a lot of these concepts for everyone, and what I hope that we can do is through answering your questions, all the participant questions, we can make it more real and more practical. Sometimes we hear these concepts, you know, be intentional, stay connected, and it's hard to know how to actually do it. So maybe that's one of the things we get to talk about here today. I was in New York when 9/11 happened, and I don't want to call myself a victim, but I definitely felt the impact of, you know, the fear and the grief of the city. I was there. I lived there back in those days. And I can tell you that what we are experiencing is very different. This is a global phenomenon. I don't think any of us had ever experienced something where the whole community, the whole country, the whole world was sharing some of these fears, uncertainties, grief. So we have become very connected, for better or for worse, but we have also become very disconnected in the sense that we, you know, to feel safe and protected, we're staying home, we're not seeing people that we care about, there's no human touch, human contact. So there's a lot of consequences to that, as Dr. Aguilar was saying. I can tell you that I think one of the things we need to do is to get creative and to get intentional and insightful about what is going on. We are all experiencing this one way or the other. And some of the things that I hear often is, I don't even know what to feel. I don't even know what this is that I'm feeling. I don't even know if I'm feeling something. And just helping you clarify what that is and helping you know that other people are feeling similar things, and that you can talk about these things, and that you can put things in place that will help you all process whatever it is that we're feeling, is going to be very helpful. We are experiencing a lot of fear, a lot of trauma, a lot of grief. That doesn't have to stay much longer than needed. There's a role that our emotions play. They are our guidance system, so it makes sense that we're feeling a lot of things right now. We don't have to internalize them and let them stay as trauma for years and years to come. Hopefully that's one of the things that we can achieve now. The goal is never not to feel, is to know what to do with the feelings that we're having. So I'm looking forward to answering a lot of those questions and hopefully share with you what to do for yourself, for your kids, for your employees, for your friends, for your family.
Thank you, Dr. Adriana, and we'll go to Dr. Williams, but I do want to say we will circle back and talk about how people in our community who perhaps traditionally have not accessed mental health care services, may not have private pay insurance options, may be unemployed now, or even small business owners that are chamber members that have employees who are very much at risk here, how they go about finding out what community services are available and accessing those, availing themselves of the services. But Dr. Williams, let me turn to you first and ask about your observations as a practicing psychiatrist at the moment we're all sharing.
Well, thank you, and I also am honored to be in this panel, and happy to present. And I'd like to speak to my experience as a small business owner, my experience just personally as a human being, and then also as a psychiatrist, with a caveat that it would be good for the audience to know that I spent the first 10 years of my career in family medicine. So actually, know a little something about microbiology and immunology and so forth. But as a small business owner, this has been the most incredibly stressful time of my career. In the very beginning, COVID went from, not a big deal and probably won't come here, to 2 million people in the United States are going to die. And the facts seem to be changing every single day. And as a small business owner, I was then needing to make policy changes every day. And just yesterday, my office manager reminded me that on March 18th, we changed policies, big policies, twice in one day because of the changing scenario. Were we going to give patients an option to come in to be seen in person for those people who really need that face-to-face contact, or were we going to switch everyone over to telemedicine? Well, in the first part of the day, we wanted to give patients a choice and have them come in to see us. But by the middle of the day, we realized, no, that's wrong. We have to switch completely over to telemedicine and adapt. By that time, had not used any telemedicine to do psychiatry. We had been looking into it, but up to then, insurance companies wouldn't reimburse for it, so it wasn't very, very practical. So we just threw ourselves into a tizzy. Made changes as to how we were delivering mental health care, trying to understand how patients were going to handle it, and then our own employees, we were and coworkers looking at each other. Am I going to give the virus to you, and are you going to give it to me? So there's a great deal of fear. And in those early days, I remember deciding, okay, gonna take this slow the spread seriously. Gonna wash my hands. Going to watch how I speak and sneeze and so forth, and just be very intentional about being conscious about germs. So I kept that up for about 3 days, and it nearly drove me crazy. And then it suddenly dawned on me, as I've been treating patients with obsessive compulsive disorders, and particularly a germ phobia all these years, I heard them whispering in my ear, "Welcome to my world." Because it's not humanly possible to protect yourself from any and all disease without living in a bubble, like people do who have severe combined immunodeficiency disease from birth. Those people. So, and we certainly can't carry on our businesses, and so there's been just a great deal of stress because the facts seem to be changing every day. And while that slowed down a bit, it hasn't completely slowed down. We're trying to decide, how quick to bring people in. What do we do inside the office? Do we space people apart? How many people we want in the waiting room as we're bringing back in? I mean, there's in our business meetings, we spend at least a third to half of our time making policy changes about COVID. And that's not to mention the stress of thinking as a business owner, feeling some responsibility for the safety of our employees and patients, and then keeping up with the financial aspects. In healthcare, I'm by definition an essential business. I remained open. We adapted, but remained open. But what about those businesses that were a restaurant or a retail? What if suddenly my doors closed, and a lot of members of the chamber, that's exactly what happened to them, and so the financial devastation, the employee devastation of people losing their jobs is very stressful, and the impact will be felt, is being felt now and will be felt for a long time. So as a small business owner, I have a great deal of empathy and also struggle, and I'll get back to this maybe later in the panel, but I want to remind chamber members that they are leaders of the community. People are looking to you to know what to do. There's quite a bit of fear-driven behavior going on. It's natural. We are living in a plague. It's hyped up by the media, and it's poisoned by politics. So we have quite a bit of, we've got stressful facts to discern and policies to develop. And so these policies, as we develop them, some of them, like I want business owners to be asking themselves, why am I doing what I am doing? Why am I making the policy am I making? Am I making it because it really will reduce the risk of infection? Or am I doing it purely and solely out of perception, to either make myself feel better or make others feel better that we're doing something? And I know that that's necessary. It does matter what other people think. It matters what your customers think. But on the other hand, leaders step out and lead. They do the right thing even when other people don't know it's the right thing. And so I have found myself very much challenged to try to understand, what does it mean to be a leader in these times? I know this segment is supposed to be short, so I will get quickly to a personal thing. So I have a 91-year-old aunt. I actually swooped into Houston and pulled her out of Hurricane Harvey. And a good thing, because the next day her house was 2.5 feet underwater. And she now lives here, and I talk to her every day. In Harvey, the wonderful thing was community just came together. I mean, people were coming out of the work, helping each other. But with COVID, we're supposed to stay away from each other. And the elderly in particular, I am very concerned about. I hear all the time, protect the elderly, protect the elderly. Well, what that means is, that's code for keep everyone who could possibly infect the elderly away from them, except maybe to bring them a plate of food. Well, excuse me, for people who are already socially isolated to begin with, this has devastating consequences. I know, I talk to my aunt every day. And so I really urge policymakers to consider that there's multiple priorities going on. It's not just catching COVID. There are other important priorities, like having people feel supported, have them not be socially isolated, being very intentional in meeting all their needs, not just the need to not be infected. So let me end there. And thank you again for being able to be part of this panel.
Okay, I think we have a great start to the conversation and lots of different directions to go in. But I'd like to ask all three of you to comment on the fact that we clearly are socially divided. We're politically divided. Political leaders do drive that division. And so we're in a community where on the one hand, the mayor and the county judge are urging people, they no longer have the authority of a mandate in their orders, but they're urging people to engage in sensible, prudent social distancing, to wear facial masks when out in public and not able to be more than 6 feet away from others, and so forth. And then at the state and national level, we have less urgency in terms of what the political leaders are saying about wearing face masks or whatever. And so you go into any given situation in the community here, and you see some people adhering to some standards and others not adhering to them. There is a lot of fear and insecurity in the community about what's right. How would you advise people to deal with that? And for business owners that are chamber members that are bringing people back to work or coming up with a hybrid work safely at home but come into the office some, what's your advice for how to manage these kinds of complex issues that frankly business owners never had to think about before?
Mm-hmm. If you don't mind, I can put my 2 cents in first, and I'm already curious to hear what the other panelists have to say, because I think this is a tough question. This is one of those that we have to sit down and think. And while Dr. Williams was talking, one of the concepts that came to my mind over and over is that we have to concern what can I control and what is out of my control. And I think going there, we might find the answers to some of these tough questions. I think each business owner, each head of household is going to find different answers to this question. We have to, this is a time to adapt to our needs and the needs of the people that we care for. And that might be our employees, or it might be our family, might be our kids or our friends. I think Dr. Williams brings something very important. There are many priorities that we have to take into account here. So of all of those priorities, considering that we still have to be careful, I feel, going personal here, I feel a big responsibility not to, spread the virus. And I know that for me, I can control that I can wear a mask. So I choose to wear a mask. I know that for my kids, for example, that's a tricky one because my daughter is already working and not many people are wearing masks and she feels weird. She has said that to me, I feel weird. I don't want to be the odd one out. So allowing her to gain a sense of, control for what she does. I have an opinion, but she gets to choose, even if the rest of the people are not doing the same, what is important to me, what I consider I can control, how can I contribute to this? If we keep that sense of community and instead of looking only inside what is good for me, I can think of what is good for, the people I have around, we will find some answers. I don't think there's one specific, perfect answer to this question.
Thank you, Dr. Dyurich. Dr. Aguilar? I think you're on mute, doctor.
Sorry. Okay, sorry about that. Yes, I think your question is a very important one. And I think it's a question that many of us are facing. And you're thinking about this from a systemic or a macrosystemic, larger organizational level. If you think about all the different ways that we are being led in our country, what I find myself coming back to is this notion of, as a psychologist, of course, I am biased towards this, psychological flexibility, this idea that we can do both. we can both be firm and set limits, but also be kind and generous. Many of us were raised in a way that makes us think that there is only one way. There has to be a lot of rigidity. It's all or nothing when it comes to the way that we manage ourselves, the way that we manage our families, and perhaps even in the way that we manage our businesses. And so part of what I've learned both professionally and personally is that psychological flexibility, or this idea to think that we can let one thing go perhaps, but still stay true to our values. It is something that will be very important. And I've heard small business owners talk about the challenge that they've had, the ethics of whether they should be opening up right now at a time when economically there's such a need for it, but maybe from a social health perspective or a population health perspective, is it the right thing to do? Am I doing the right thing for my community? Sometimes the community needs that business. And so I do think it's this idea, very much like Dr. Adriana said, to really think about what you value, and not only from a personal perspective, but also from your professional business perspective. What are your values and missions that is driving your practice and driving your business, and perhaps using those values to create the action that you need. Part of what we know is that if you can do one thing that is related to something you value most, even if it's just a very small thing, it can help us feel better, and it can help us with our own mental health. And of course, that's going to have a ripple effect to those around us. So, I think about that. I also think what Dr. Williams said was so key, that small business owners are leaders. And today and kind of going forward, there's going to be a need for this, resilience in leadership, right? How do you muster resilience? Many of us have that experience from our own backgrounds. And I do think it's about making very tough choices in a very difficult time, but then it's also about being able to be okay with the decisions that were made. Sometimes they might have maybe a personal benefit. There might be a more economic benefit to some of the decisions that we make. But again, trying to have that flexibility in your thinking could be really helpful going forward. I mean, all of our research we know says that psychological flexibility is one of the is a hallmark of mental health. So I hope that's helpful.
Dr. Williams, I was really struck in particular by your very strong image of politics poisoning the public conversation. And I just wonder whether you see the pandemic and the ensuing economic implications of it as an opportunity for this community, this city and county, to come closer together and to address some long-term ills that haven't been addressed in deep ways, or whether you fear that in fact the moment will divide us further, and perhaps we're right now in a position to choose one path or the other, and I'd be interested in your thoughts on how we take the right path and not the wrong one, and not let the stress of the moment further divide us, but in fact help us, as Dr. Adriana said, think not just about ourselves, but about the community and those around us.
Well, I have no idea what the community will do, and actually the community doesn't decide to do anything. It's individuals. So this is a wonderful opportunity, is what it is. A wonderful opportunity to show love. And love has to do with putting other people's interests ahead of your own, while still considering your own needs. That's a healthy form of love. And so I think giving each other quite a bit of grace to have differing opinions When people are afraid, they can't help in that moment that they are afraid. Even if, let's say, scientifically, I might know more than they do and know that they don't have to be quite as afraid as they are, that doesn't help them. I need to not be judgmental about their behavior, and then hopefully they won't be judgmental about my behavior. So I think giving each other room for differing opinions, while all being in different boats, but remembering we're in the same storm, and ultimately wanting a good not just for ourselves but for each other, that will win the day. And I've lived in San Antonio since 1996, and that's the city I have found myself living in. That's what I love about San Antonio.
No, I think that's a good point. Let me ask you all to get more specific. If you were literally talking to some of the chamber members that are small business owners, who would tell you that they do care intensely about their employees and the businesses that they've founded and built, but they're not very schooled in addressing mental health issues for their employees and in fact for their employee families. And now some of them might very well, I'm sure they do, have employees who have issues at home that are having a profound impact on their abilities to perform their jobs, particularly working remotely. And I wonder what advice you would give to those leaders, as Dr. Williams called them correctly. How do they pivot and perhaps acquire some new skills or be attuned to new levels of sensitivity for sensing things that they didn't previously have to sense in the workplace or give very much attention to, but now might be quite important to the well-being of their employees and in fact the organization going forward? Any one of you that would like to address that, please just jump in.
Well, the first thing that I have done is I've tried to help my employees understand at least my perspective of the facts, because I think sort of a fear-driven behavior, herd mentality is won't help us very much, and so with this being bombarded by statistics, I've tried to put that in perspective. So, for instance, while the number of cases keeps going up because we have more and more ability to do testing, it doesn't mean that actually risk has gone up. I follow the math every day. I go to the Bexar County website to check the numbers, so what really informs us about how much illness is in our community is not the number of cases diagnosed, it's the number of new hospitalizations each day and the number of deaths. And the average number of hospitalizations per day, and has been remarkably steady for 6 weeks, has been about 5 new hospitalizations per day and an average about 1 death per day. Yes, there's been a little bit of a decline in most recent weeks, but on average, those are the numbers in a city of 2 million, or a county of 2 million people. So it's hard for us to get our minds wrapped around very small numbers, but helping our employees understand what the risks probably actually are is an important thing. But then still paying attention to their fears or needs. So I have elderly employees; they're working from home. I have an employee with immunocompromised illness. They are mostly working from home. I have parents who are trying to homeschool their children and work. Mostly they're working from home. Others have been coming into the office. So I think tailoring the workflow to the needs of individual employees is how we show that we care for them.
Well, one quick aside, just as the media guy on this panel, we have tried every week to point out to people that we were the first major city in Texas to shelter at home, to work at home. That paid off enormously. Every single week since the state has been reporting statistics, San Antonio and Bexar County have had the lowest per capita incidence of both positive cases and deaths compared to Dallas-Fort Worth, compared to Houston, even compared to El Paso. And so the relatively low numbers that Dr. Williams cites are in fact correct, and that's something we try to make sure that that informs our coverage every week, and that we avoid sensationalism or over dramatizing the situation. But it's hard to credit prevention or measure prevention and its positive impacts. But there's no doubt here that the quality of our local leaders and the very tough decisions they took in the beginning, when it wasn't popular to say that restaurants and bars and other venues had to close, there's been a real return on investment for what they did there that we can now see in the numbers. But Dr. Aguilar or Dyurich, do you want to address that issue of how small business owners and leaders now have to re-examine their own processes and approaches to people?
Sure, definitely. I think one thing we're seeing here, we have worked very hard for years to get rid of the stigma of mental health, that if you are feeling things, you're sick. And I think that's one of the silver linings that we're gonna see from this pandemic, is that we are more open to talk about this as a human phenomenon. We do feel. We feel fear, we feel anxiety, we also feel joy and love and all the things that hopefully we're feeling these days. I invite business owners to open this space for a more natural and honest communication of what we are experiencing. I think what Dr. Williams said is very important when we are talking about the practical issues of, you know, how to schedule shifts and how to the workflow. I also think that it's important to be able to talk about these things. I don't think anybody expects business leaders to know how to respond as a mental health professional. We have worked very hard to be able to do what we do, and we still have to continue learning and practicing and growing, because it is challenging. Human beings are complex. But to be able to validate what people are saying, to just know that, you know, we're listening, and through that openness and honesty, to be able to be flexible and adapt to people's needs. Again, I don't think there's going to be one solution that fits everybody. And that's why it's okay to say, tell me what your experience is. I've experienced something similar. Maybe I cannot help you with this. Maybe there's somebody else that is a professional and can help you. But to open space for that conversation could be a very healing and a connecting activity.
Maybe we can go back to a question I posed earlier that we didn't get into. What is your counsel for individuals who would say to you, I'm already under significant financial stress at home. Even if I have benefits through my employer, they're not very good for paying for mental health care services like therapy. How do I access in the community the services that are available to me? And Dr. Aguilar, probably where you work at the Center for Healthcare Services, that would probably be the most appropriate one to take that on. But people don't know who to turn to, or how to turn, or what services at the county level, the city level, are in fact available at either no or a very affordable cost.
Yes, I think part of what you're hitting on speaks to we were in an existing mental health crisis in our country before the pandemic hit. Mm-hmm. We know that there is a significant shortage of mental health providers, especially in Texas. Psychiatrists, Dr. Ted Williams is a unicorn in some ways, because there are such few psychiatrists in the state of Texas. And we don't have the right proportionality of mental health professionals to the needs that are out there. The pandemic certainly has highlighted the need for mental health services. And just like Dr. Adriana said, what has been, in some way, the silver lining is that it has normalized the sense that we all have fears and that we all need to be connected to one another. And we all need to pay attention to our mental health in order for us to continue to live. Mental health is health. And for a long time, even in the way that our insurances were set up, mental health was always a carve out and something very specific that was happening in a very separate way, even paid for in a very separate way. A lot of that has changed over the years, but we still have a long way to go. That being said, there are many things that perhaps employers are not aware of, but there are many hotlines that employers can provide to their employees to talk about the distress of the pandemic. The Substance Abuse Mental Health Service Administration has a hotline that I can provide for people to talk to and access more resources. The state of Texas, the Health and Human Services Commission also has a hotline as well to help people connect and speak to professionals should they need to, if they're feeling under stress and duress. Additionally, there are some organizations, including our own throughout the community, that are offering services to help people telehealth through phone calls or even through video chat to help people access counseling, therapeutic support, or discussions, consultations to help people manage some of the stress that they're feeling. I guess the other thing that I would offer to small business owners, I do think people become very nervous thinking about like, well, I don't want to open up this discussion because I'm not going to know what to do and I'm not going to be able to have the resources to manage it well. What we know is that there's a lot of power in acknowledging the struggle because it is a connecting force. And so if you are able to kind of have a huddle with your team, it doesn't have to be a long, drawn out 3-hour meeting, but have a quick huddle to say, hey, I want to check on everyone. How is everybody doing? What have you done for your mental health today? How have you taken care of yourself today? We've heard this repeated mantra of the airline. If you're on an airplane, put the oxygen mask on yourself first so that you can put your oxygen mask on your child. That's true. We do need to take care of ourselves and each other so that we can provide the care that we want for the people that we love and for our employees. So checking in with people and identifying perhaps people that might need more help or resources is really a way of providing connectivity and helping people remember the mission and vision, I think, is a key thing. Your passion is what got you into your small business venture. And so trying to connect to that during this very challenging time, I think could also be very important.
Well, thank you for mentioning those hotlines too, Dr. Aguilar, and in our coverage of this event on the Rivard report, we'll publish links or phone numbers so that people that are tuning in and might want to share those contact opportunities with their employees and their families will have them. We'll make sure we get those. Dr. Adriana.
Sorry, I just wanted to add that in my personal experience, I have led several groups and big discussions about this issue, and I have found that when we open that space and we normalize and we help people validate their feelings, there's also a lot to say about the connections that are created between them. And there's a lot of solutions that come up just from having the conversation. So as a business owner and leader, you might not have the answer, but by opening up this conversation, they might find the answers and the support they need in their colleagues, in their friends, in their, the people that work with them. And that also has a lot of value.
I would say that the prospect of people who are, let's say, jobless and financially strapped, having their physical and emotional needs met, these very real, very pressing needs, a couple of things. I think the food banks are very helpful, and volunteerism is at a high right now. People trying to help each other, and I've also noticed this very much in the faith communities. Dr. Aguilar earlier spoke of finding your anchor. I have a definition of what a crisis is. A crisis is when whatever you had put your hope in to make yourself feel safe, significant, and satisfied in the world, whatever that is, when that's suddenly revealed to not stand the test of reality, that's a crisis. And the crisis has caused people to think more about faith and spirituality, and it's caused faith communities to step up and try to help each other. Now, it's difficult since it has to be done virtually up to now, but I know of many churches who are more than happy to help with food, help with support, even sometimes pay for talk therapy or psychiatric help. So our faith communities are needed, and they are helping. And our own personal faith, when temporal things aren't steady, eternal things can help provide that steadiness.
Speaking of external things, I wonder if any of you would agree with me that one of the things all of us can do for our emotional health is address the value of physical recreation or exercise at this time when we're spending so much time at home. And we've reported, of course, a record number of bicycle sales and repairs, people pulling two-wheelers out of garages that hadn't been pulled out in many a year and dusting them off. I live near the San Antonio River on the Mission Reach, and it is literally crowded with people of all ages and backgrounds now in a way I've never seen it before. And so I think that daily walk with the dog or the children, or just among yourselves with your senior at home, can be something that really becomes something that subliminally helps in other areas of your life.
Definitely. Exercise is something that we have known for a long time to help. It's for many people their way of meditation. When I talk about meditation and mindfulness with my clients, I said, for me, might look like, sitting down and going on, but it doesn't have to look like that for everybody. And for many people, the daily run or the walk with the dog is their form of meditation. And what we want to accomplish with that moment of mindfulness is to be present, to be here and now, instead of letting our minds go to the future and, feed our fears and our anxiety for uncertainty, or going to the back, to the past to say, what I've lost, how I used to be, that I don't have it anymore. Just be here and now. And that exercise can provide that. The other thing that we might be getting a lot of benefit from, that we're reconnecting to, is nature. We tend to forget how healing it is to just be outside and hear the birds and see the trees and watch the water flow. But it has a very healing power for us, for humans. So,
amen.
The research has just been pouring in over the last 10 to 15 years about the impact of exercise on mental health. There are studies looking, for instance, at depression relapse. In other words, people who were depressed or no longer depressed, will exercise help keep them from becoming depressed in the future? And the answer is a resounding yes. Exercise significantly decreases the chances of becoming depressed and helps people come out of depression. And it goes right down actually to a neurobiological level. When people exercise, there is a growth factor, a nerve growth factor in the brain cells release that causes branching of brain cells. Exercise increases the connections of networks in our brain. So, so people wonder, well, how much and how often? It's real simple, 30 minutes every day. That is a lot more exercise than most people have been getting. Although during this pandemic, people have actually been taking advantage and getting maybe that walk-in every day.
Very good points. I'm going to take a bike ride right after this program and think about all the great things that you shared with me. We're coming up to the question and answer period here momentarily, a few more minutes, and I would encourage people listening to toggle down to the bottom Q&A there and post a question. Don't worry, you won't be on camera. You don't have to read your own question. We'll go through those for you, and would love to hear from more of the listeners and not just have the panelists responding to my questions. But I do want to turn to one that comes out of the education forums we've been doing at the Rivard Report the last 3 weeks, and talk about a different kind of trauma that school leaders encountered. Distance learning turned out to be a much more complicated factor because such an incredible percentage of our population, first of all, does not have high-speed connectivity at home or smartphone devices, tablets, desktops, etc. Second of all, what they realized is just as at school, they've got to deal with so many other aspects of the emotional trauma. You can't expect people to go onto a computer screen and start learning when there's food insecurity, when there's emotional trauma at home. And the school leaders realized they needed to connect with the families as much as the students to initiate distant learning, because they had to engage the parents in it and help the parents overcome their fear. And in many cases, we're dealing with parents who were not successful in their own education efforts, but are looking to see their children do better. They're working hard to get their children the opportunities for a full education that they themselves didn't realize, but they're fearful of engaging in the education process itself, the at-school learning. So for people who are small business owners, people that are working at small businesses in the chamber, what is your advice of how to embrace this very different and new reality of your children are at home, they're going to, for the foreseeable future, even in the next school year, not go back to traditional classroom learning, and you as a parent must find ways to engage in this and help set the example for your children to understand the importance of the opportunity to learn in a new fashion. It's frightening for a lot of people.
I mean, I do question the wisdom of not reinstituting normal classroom teaching in the fall. I'm just putting it out there. I question the wisdom of that.
I think that's a good point, because there's no way educators say for them to social distance the way you can in so many other aspects of the workplace or society. They can't reduce dramatically the teacher-student ratios. When you're talking about preschoolers who learn by playing, you're not going to keep them 6 feet away. And so they're going to have to come up with understanding this balance between what they think about public health and restoring normalcy, or some return to normalcy in the next academic year. And I know they're all wrestling with that and trying to look at different models of how they deal with that. Even as the parents at home, quite frankly, some of them are expressing fear and insecurity about allowing their children to go back to school. Mm-hmm. Any thoughts that any of you have on navigating that peril?
Yeah, this is another very complex question, and I think I'm going to go back to my default. We have to pay attention to our unique needs and the needs of our family and, close group of friends, and make decisions based on that. But talking in a general manner, I worry also about all the parents that need to go back to work, but the kids don't have school or daycare to go back to, or they're afraid to send them to school or daycare. I have encountered that worry at every level for many different clients all over the place. And the whole issue, going back to your question, Bob, the whole issue of homeschooling has been, wow, a hot topic. And I am talking here not only as a professional, I am also a mom with 3 kids, and I've had to suffer through the homeschooling, and it has been hard, especially if you're working at the same time as trying to homeschool. Both activities require a lot of time and energy and mental concentration, and we cannot do them, you know, at the same time. It has been challenging. What has been helpful to me is to take a step back and say, what do I really want to teach my kids through this? Yes, they have to learn, you know, some content to be able to pass their classes. And I know the teachers are doing a great job trying to put that content out there to help them learn. But I've chosen to teach them bigger lessons, right? Your responsibility, learn about the pandemic, what has been doing for our society. Some things I've had to let go. Some things I've had to say, you know, this is not a priority for our family. So if you don't do so great in this specific class, or, you know, with this specific thing, if we were in a different situation, I would care very much about that, but we have to prioritize and give ourselves grace as parents going through that. It's gonna be very important. I think at the beginning of the pandemic, we saw this, you know, impetus, everybody, oh, we're gonna homeschool, and we saw all these tips from how to keep kids engaged and do all these things. And then we hit reality and we realized this is hard. This takes a lot of energy. This is not, you know, teachers learn and train for this. And it's very different to send them there and then come back home that spend 24 hours, 7 days a week trying to manage everything. So giving yourself some grace and prioritizing again, what is important for me that they learn in this moment, because it might not be math right now. It might be something else.
Yes, I guess I'd like to just add to that, in some ways capitalize on some of what Dr. Adriana said. It is, I think, a really important notion at this time, and although it might be hard for those of us who are high achievers, to dial down the expectations of what can actually be accomplished. And so sometimes being able to set an intention that you will be able to let go of something, it might seem counterproductive, but could be very helpful to the course of the day. Now, you're asking about people who are in families that are stressed by needing food, by having a child trying to learn while they are hungry. Those are very real and very significant questions that our community has to address. But as a parent, I think part of it is understanding how to embrace and respond to change. And so while you know, we may not have the most optimal circumstance in our home, trying to do our best and perhaps creating a new kind of routine, a new kind of memory for our child is going to be a really important thing to do going forward. So learning how to manage change, that's kind of like the $1 million question. If we all knew how to do that, you wouldn't need my profession. So I think it's very easy to say and very hard to do.
Well, I think that's a good note for us to wrap things up. Unfortunately, our hour has gone by so quickly, and I'll give you each a minute for just one last brief thought. But my own is how fortunate we are to have individuals like you in the community to turn to at this moment. And it seems to me that we are talking about the issue of mental health now more than ever before, and that's a good start. Raising community awareness and engaging the community on it and getting people over their stigma about it seems essential. And Dr. Williams, any last words?
I think I would urge business leaders and policymakers to think about why they're doing what they're doing. I think we've been all so captivated by the fear of us getting this illness or the fear of others getting this illness that actually that fear has loomed a little bit too large and has been out of perspective compared to other fallouts from the decisions that we're making. Education, for instance, a risk-benefit decision that I make risk-benefit decisions all the time in medicine. So what would be the actual risk of children going back to school versus a normal school versus what would be the risk of not going back to school normally? It has risks too. And I think that we need to consider why we're doing what we're doing.
Okay, Dr. Aguilar, last thought.
Yeah, I guess a few of my last thoughts is that I guess I just want to, normalize if anybody is feeling stress or worry or fear, that is common, and it's what makes us human. Acknowledging those thoughts and feelings, while some of us feel like we need our armor on all the time, and we're not allowed to feel that way, it is very important for us to allow ourselves to acknowledge that. I like to say at these sorts of things, if you don't acknowledge your emotions, your body will speak for you. So we tend to start to feel things physically if we don't express them psychologically or verbally. That's a very important thing. And that it's okay to ask for help and ask for guidance. We were put on this world to be connected to one another. And as humans, we are wired for connectivity, which is why I think this has been so challenging. So I think if we can persist and keep going, asking for help when we need it, it can be helpful.
Thank you. Dr. Dyurich, quickly, any last thoughts?
Sure. I just want to invite, there's so much that we can say, but my last thought here is I want to invite people to maybe understand this moment as a moment of introspection and insight, and to take advantage to revisit your priorities, what's important for you, the people that are important for you. And I think through that, we are going to find a lot of answers to very complicated questions that we're facing.
Well, thank you all to our panelists. And Dr. Era Gonzalez, you're a physician and a small business owner yourself. So thank you so much for putting this program on and giving all of us the opportunity to share everything we've discussed over the last hour. And now maybe we can turn to some of the listener questions.
Absolutely. Thank you so much, Bob. It's been great discussions. We've heard so many wonderful pearls and advice that we've got these questions rolling in. So I'm just going to go ahead and jump in. The first question has to do with a little bit with Dr. Aguilar was just talking about, and I think that early on was also stressed, is that how important it is for us to allow ourselves to feel. So we shouldn't stop our feelings. But the question is, what do we do in order to process these feelings in a healthy manner? So when we're feeling overwhelmed and these feelings that we're experiencing are flooding too quickly for us to process, what is the first thing that we can do to help us start that coping mechanism that is healthy for us?
I can answer for Dr. Aguilar. One of the things that is very helpful is to remember that emotions are emotions, thoughts are thoughts, facts are facts. Sometimes we confuse them all. And sometimes we think that because we're having an emotion and the stronger that emotion feels, the stronger the intensity, it must be based on reality. And one of the things that we can do is to just acknowledge that what we're experiencing is an emotion, and they are normal and they are human, and they're our guiding mechanism. it doesn't mean that they're based on a fact or that they are necessarily a thought. So once I sense what I need to feel, then I can make that distinction. Where is this based on? Where is this coming from? A lot of our fears have to do not only with what's happening right now, but with our previous experiences that we're bringing now as we're comparing what we know with what is happening right now. And either because it is too familiar for us, we've already struggled with this and I know how hard it is, or because it's completely new, we might fear, we might experience with more intensity some things. So feel what you need to feel. Usually emotions don't last more than a few seconds. And then you can make that distinction. What about this is reality? Where is this coming from? What are my thoughts related to this emotion?
Great.
Yeah, and can I just, I'm sorry, just really quick,
please go ahead.
say that this is what I was referring to earlier when I kind of first opened up, this dropping the anger activity. This is the dropping the anger activity would be a great response if you're feeling overwhelmed, which involves acknowledging your thoughts and feelings, very much what Dr. Adriana had just recited, and then doing something physical to come back into your body. So that might mean trying to press your fingers together and focusing on that physical sensation, straightening up your back and straightening up your posture and trying to pay attention to that. So going to something very physical after you've acknowledged your thoughts and feelings can also be very helpful, which is part of what this dropping the anchor exercise helps you do. Stretching, trying to push into the floor with the bottoms of your feet. Doing something very physical can also be very grounding and helpful. And then with all of your internal mental resources, trying to really focus on the here and now and on the present moment activity that you're doing. And that can really be a way of organizing your internal self when you're feeling overwhelmed. And I have a resource that I can also let everybody have if that would be helpful that I mentioned earlier.
Thank you, Dr. Aguilar. That would be extremely helpful. And so this question kind of piggybacks on what we are discussing right now. And we have a physician in the audience, Dr. Altamirano, who works in an ER and states that he has diagnosed acute stress reaction more so than ever in these past 6 to 8 weeks. So he wants to ask Dr. Williams if he can discuss his prognosis and timeline when people should seek medical attention. So when is it time to say, you know what, I think I need a little bit more help than I'm able to give myself? Dr. Williams?
Yes, just trying to decide how to answer what you're saying. Probably the psychiatric condition that is would be the most important one to recognize and address is depression. So what's the difference between being down, even upset, and depressed? The difference is that in depression, it's not just down mood. It's down mood, low motivation, changes in sleep, changes in appetite, difficulty with concentration, difficulty with motivation, a lot of negative self-talk, feeling that you've let yourself or your family down. And then some of the more extreme thoughts are thoughts of self-harm or thinking that you would be better off if you weren't alive. I have seen already in my practice patients who were struggling somewhat with depression before COVID hit, and then COVID has just been too much, and so depression is serious. It needs to be addressed. With depression, you can't just pull yourself up by your bootstraps. This would be a time when getting professional help, either through talk therapy or possibly medication, should be considered. So that would be, I think, the most pressing.
Thank you for that. And I think that's a very important message to get out there. And I do want to note that there's been a lot of people who have posted different resources that are available in the community in our chat box. And so we'll make sure to get those out to everybody on the webinar today too, so they can have those available to them should they need them. Another question coming in is, how long will the effects of COVID-19 on an individual mental health last? So are we expecting these to be long-term effects? Is there, a light at the end of the tunnel that this will kind of pass as quickly as, soon after when this pandemic is over? Or what should we expect?
I guess what I will say to this is, we've all heard, and there's been a lot of discussion about flattening the curve, right? Flattening the curve to make sure that the physical, biological, contagious effect doesn't reach a point that our resources are outpaced. There is very much, I mean, nobody talks about this, but there's very much a mental health curve to this pandemic as well. And nobody has really talked about flattening the mental health curve. It is something that we have in my community, in the psychological community. It's something that people discuss and think about quite a bit. And there has been quite a bit of discussion about what the mental health curve looks like compared to the physical health curve. And because, as I said earlier, we were already in a mental health crisis in our country because of the few providers, we can expect that tail to be much longer. And we know that the things that we do now will have an impact on the future of that curve. And so it is really important right now. There's been a lot of emergency legislation and funding for healthcare service agencies like the Center for Healthcare Services. But this is going to be a very long battle, I would say. More so for people who have existing serious mental illness, and more so for people who have significant physical health issues as well. So in some ways, I mean, I guess I don't mean to be a Debbie Downer, but in some ways I do feel like the mental health effects of this pandemic are going to be much longer lasting than the physical health ones.
Thank you. There is a question, and I love this question because it shows just the compassion in our community. But there's an audience member that wants to know, what can we, even as business owners that are opening up our businesses again, do to help with some of these issues? Would posting signage about mental health or asking simple questions like, how are you doing, or how are things going, does that actually help, or are we going to make things worse?
That actually helps. And I'm glad that they're asking this. I know that's a big fear that people have. And we talk about this more when we're talking about suicidal thoughts and suicidality. People are very afraid to ask, are you thinking about hurting yourself? But that's exactly what we need to do, because we need to talk about these things openly. It does help in so many different levels to be able to ask, how are you doing today? And to be ready to hear an answer, even if you don't know what to do about that answer, but just to be open to listen to people. It helps because it shows care. And right now, one of the things that we need most is that connection and knowing that other people in our community care, but also helps because allows people to process what they are feeling and to be able to put it out there. We are, one of the biggest differences I'm seeing is that we used to ask a lot, oh, how are you doing? And we know it was a rhetorical question. We wanted to hear, all good, thank you, move on, right? We weren't ready for an answer, but I see more and more, how are you doing? And getting an honest answer. I'm stressed, I'm anxious, I'm afraid of this, or I'm actually doing great. I've realized a lot of things that I didn't know before. So yes, it helps. Please go ahead and ask. Please go ahead and create a culture in your business and your environment where people can ask and answer honestly about these things. And also helps because it normalizes that you might need help from a professional, and that's fine. You're not crazy, you're not sick, you just need some support. And that is so important to, express right now.
I think business owners are in a unique position to help our community by showing concern for their employees. So in other words, it's not only about how you're doing your job, it's also about how you're doing. And when supervisors and business owners care about their employees, and especially during a time like this, it's very much felt and it's very much remembered. Some employees will tend to judge how they were treated during this time. Were they listened to? Maybe they didn't get the answers that they, or accommodations that they were exactly looking for, but did the employer care about their well-being? Yes, I think it's hugely important for employers to show that.
Thank you. There's so many good questions that are being asked, and we're running short on time. And so I apologize for the questions that we did not get to, but I want to end with this one because I'd like to hear from each of the different panelists and get their insight on this. So the question is, what would you describe as one silver lining to this whole situation? So what would you tell people, like, well, at least we can, focus on this. What would be your silver lining to this pandemic? And if, Dr. Aguilar, if you'd like to start us off.
Oh, okay, sure. So, I think part of what has been a silver lining, at least at the Center for Healthcare Services, and I just think in general for healthcare, is we have been, I don't want to say fighting, but really trying to increase access to services. And it really wasn't until the walls were removed, so until we were taken out of the clinic and were forced to shift to a telehealth remote service, that Medicare kind of came on board and said, yes, we will reimburse for some of these services right now. And lo and behold, they have found out, hey, this works. It works in a way that can be helpful to people. We can access, people can still get quality care. So I think it has, in some ways, shifted the healthcare landscape and provided increased access to services because people are able to access what they need from their own home or from their neighbor's home where they can access a computer. That has been, I think, a surprising change at our center, and also it's been a very welcome thing, I think, for the entities that fund us.
I agree with that. That's been an important silver lining that has been surprising. We have patients who come to our clinic from Laredo, the Valley, Corpus Christi, Victoria, rural areas. And there was a kind of an artificial, telehealth was being held back artificially by insurance companies and by government payers. And that just got blown away. And patients love the access that they are getting through telehealth. So telehealth is here to stay. That's a good thing. Now we're gonna have to figure out how to use it properly. That's important. The other thing I would say personally is, before COVID, I was going personally at breakneck speed. My life was so busy. And it forced me to slow down a bit and reflect. And I think this has been an experience of many of us. It's like, did we really have to be doing all the things that we were doing before COVID? So I think, you know, when we start putting pieces back together again, hopefully we're putting them with like a different view to our priorities than we did before.
Yes, I can say amen to both of your silver linings. Definitely, I find myself sharing with you in that. If I can add one more, what I perceive, for many years, we've been talking about isolation as a real problem in our community. Not now, this is not new. For years, Dr. Murphy has been talking about this for years, and how isolation has very serious consequences in the mental and physical health of people, and that we as a country are very isolated from each other. I think this pandemic is showing us very clearly the importance of connection. And I hope that one of the silver linings, one of the lessons that we're going to learn is that we need to create those very honest, close, and real connections with the people that we care for.
Yes.
Thank you. I really love all of that. I think that that's wonderful. Before I hand it over to General Ayala for the closing remarks, I just want to thank all of our panelists, not only for being here with us today, but also for the work that you're doing in the community. It's work that we've known for a very long time is very much needed. Not only that, but you guys are getting overworked because there's just not enough of you. And it only shows that how prevalent of a problem it is in our community when we don't even have enough community help to kind of keep up with it. I also want to sincerely thank Bob Rivard, because as one of the leaders in our community, he's also always been a huge advocate for mental health awareness. You know, I want to thank you for being a leader in that as well. Lastly, before I hand it over to the general, and I'll let Sophie give you more of the details towards the end, but as we know, we've talked about a lot of issues surrounding mental health right now, and one thing that we will see during this pandemic that's going to parallel a lot of what we see in our military community is PTSD. So we will be having another seminar next week, specifically kind of looking at PTSD with some of our military service healthcare providers, and I'll let Sophie kind of tell you more about the details so you guys can join us for that. But thank you all, and I'm going to hand it over to the general so he can give his closing remarks.
Well, hey, thank you very much, Bob Rivard. Thank you, and the panelists, Doctors Williams, Aguilar, and Dyurich. Great job. Very interesting conversation here. Before I forget, Victoria Shoemaker, Sophie Torres, and Dr. Erica Gonzalez, thank you. This was tremendous. Right before I got off active duty, I sat down with a group of folks. We were not social distancing at the time, and we had all just come back from a combat deployment. And boy, it was the conversation is so similar of what I heard today. You know, not. You know, you can't help how you feel, and you have to deal with those feelings. The stigma, you can imagine what the stigma is for military folks, especially come in that culture and that society. So this was very, very good. I look forward to the next one. But like Dr. Erica was saying, there's some nice pearls in there. Different boat, same storm. But anyway, great session today. Great webinar, and thank you very much. And I hope to one day see all of you in person. So thanks again, and have a good week.
Thank you everyone for attending and participating. We really appreciate your participation. Thank you to our generous sponsor, UT Health San Antonio. To all those who had additional questions, we will be following up with an email, and all the attendees, we will be sending out additional information, including the upcoming webinar that Dr. Gonzalez mentioned. Again, thank you so much for joining us, and we hope to virtually see you again soon. Have a good day.